Now, the whole GCC region is attracting a lot of attention at the moment. The region has a lot of capital to deploy, there's also a lot of capital coming into the space. And from an investment perspective, that's great. But also, the region has a very big population advantage. If you look at the population pyramids associated with some of the GCC countries, they've got a good supply of babies coming through, they've got a healthy aging population. Now, Dubai is an area that's attracting a lot of attention. And I haven't been to Dubai for quite a few years, but I know there's a lot going on there. And we figured it would be good to speak with somebody in the know. Now, Dr. Anmol Kapoor is a cardiologist. He's also the chairman and CEO of BioAro Group, which has set up a new clinic in Dubai. It's not just a clinic, there's a whole system around that. And I thought it would be good to have a chat with Anmol to see what's going on in the space. So, Anmol, thank you so much for joining us. How are you?
Not bad. Thank you so much for having me.
Great. Well, before we jump into Dubai and what's going on there, we're going to talk about your perspective on longevity. What does longevity mean to you, Anmol?
Well, being a cardiologist, my job has always been to make people live longer. So that is definition. I'm a longevity doctor. So whatever I have to do with the heart medications or prevent MIs and make sure they last longest when they have heart failure. So I've been expert in managing the disease and helping them live longer, whatever means I have. But now the focus of has always been in my practice, providing primary prevention side. So how we can delay the onset of the disease, and this is how I focused my practices over the last 14 years or so. And to me, longevity is living longest, healthiest. And if you can remain healthy the longest, that's longevity for me. And the onset of disease eventually will happen, but if you can delay it as long as possible and extract maximum output from a human potential, that's longevity to me.
Yeah, well, I mean, obviously, that's very much the theme, isn't it? This compression of morbidity at the end of life, not necessarily extending lifespan without that health span imperative that sits behind that. So you're taking this philosophy now through to the work that you're doing in Dubai. Now, Dubai is obviously attracting a lot of attention, as I mentioned earlier. A lot of capital coming in, lots of clinics we hear setting up in the space. So what do you see what's Dubai's advantage for setting up longevity practices, would you say?
Well, there are a few things that go in favor of Dubai versus Hong Kong, Singapore, and many other global cities. It's a global financial hub, and it is a young city. Digital savvy, digital adoption is significantly higher than many other cities. Almost everyone has smartphones, and they are digitally connected, either through banking or other everyday life. They have to order food, medicines, talk to a doctor. So the population is already exposed to technologies, and they have adopted significantly. And since it's a global hub, so people from all over the world are living there, and most population is younger side, the expats, and the people we want to focus on and keep them healthy the longest, and get them insights about the biological age, the different chronological ages, and how they can keep themselves healthy the longest. And the corporate head offices are moving near Abu Dhabi, in the whole UAE, either Ras Al Khaimah or Sharjah, they all are pushing above their weight. They're all getting inspired from their big brothers. So all this momentum is shifting in the whole UAE and broader GCC market. So we do see us growing in overall GCC area, in Saudi Arabia, Bahrain, Qatar, Kuwait. So we do see us growing eventually in those segments too. But Dubai was the first place one to come in, try things, learn from people living there because it's international. People from every city, or so every country live there. They speak multiple languages. And the challenges in technology deployment and the improvements we can do, that is going to help us globally. It's like basically planting a seed there, and from their seed grow a big tree that will be giving fruit in every country possible. So
Okay.
that's our vision and the dream.
So we see obviously a lot of mixed messages that come out of media from Dubai, right? Excess. So in some respects, so there's a confluence of many different cultural ambitions as well as personal ambitions manifesting in the space, and obviously there's a lot of that is aligned with luxury, right? So how would you align the this sort of external persona that we have of some people may have about Dubai? There's this kind of culture, high-paced culture, very rich culture. How does that extend into optimizing health and health span and wellness for people? And does that get down to somebody who's lived in Dubai for 50 years as a native citizen, for example?
Well, Dubai had grown. I'm new to Dubai, so if you compare that to someone who's been living for 50 years in Dubai, they see a huge change. Some may like it, some may not like it because there are too many people there in a small space. And they have fast pace, and because of fast pace they are working, trying to make a living and trying to earn money and improve the quality of life, not within Dubai itself but also back home wherever they eventually move back, and that's putting extra pressure on their health. So UAE overall has a younger population but especially exponentially higher rates for cardiovascular diseases, people developing premature heart disease, hypertension, sleep apnea, you name it. They have a huge prevalence and incidence of diseases as compared to other countries. And I guess this is a population that coming in, perhaps maybe unhealthy, they bring unhealthy habits there in the region. And at the same time, the stressful level, the levels which is always 24-hour on the go. That is also contributing in increasing this burden of a disease onset early on. If we can tackle that, we are not only going to help the Dubai and the overall UAE market, but we're also going to create a chain reaction in the neighboring countries. Because many people from those countries also come there and live there. So the knowledge will be transferred very fast in those countries. So we see a challenge that yes, lots of people, lots of young people working hard, a 24-hour work environment. But at the same time, I was inspired from Dubai Fitness Challenge that was running in November for 1 month. The government has put an initiative. Like, who does that? The whole city or the Emirates was dedicating resources for the fitness challenge for everyone.
Hmm.
And then they had a race on Sheikh Zayed Road where everyone ran whatever the capability was, either 5K, 10K kilometer, and this whole challenge ran for 1 month. So their focus making expats healthier and all the resources they could dedicate, they're doing it. Even mass public awareness education events like Dubai Fitness Challenge. That's
Hmm.
what inspired us to
Yeah.
launch our Longevity Fitness Challenge. So I'm very positive. I like the environment, I like the energy, and I do see a huge scope in longevity medicine.
Yeah, so obviously, let's talk about BioAro. I mean, obviously, you've got the clinic that we're going to talk about in a moment, but also you're a technology company, and I guess we as humans, through our wearables, we create an immense amount of data. How would you see that individuals can really use that data to help them with disease prevention?
Well, as simple as having how many steps we walk. We know that the more we walk every day, the longer we're going to live. If we can get a good amount of sleep every day, the longer we are going to live. If we hydrate ourselves, if we're going to put a sunscreen in the hot atmosphere outside, we are going to live longer. And if we have an awareness about the air quality we are breathing outside or inside, if we can improve it, we are going to live longer. So all of those parameters are helpful if you're able to make people acknowledge it, and that there is an AI tool that can remind them, nudges them, and help improve their lifestyle and the quality of life. That's what the whole mobile application, when we launched in UAE, it's a global mobile application by Longevity, essentially world's first longevity-focused mobile application, where we integrate variables, we get all the data in real time, and understand through our AI tool what actually is happening, and then AI nudges them. It's like their personal assistant and guides them along the way to help understand how they can improve their lifespan. In fact, as simple as a tool regarding air quality index will tells you if you continue to breathe the same amount of air, it is going to shorten, and how many days of life are shortening because of that. And it is there. So it's help create awareness. Yes, I cannot change the air quality outside. We don't have a power. But we as a population, if we can get awareness, it helps everyone because pollution levels the playing field. There's no rich or poor. Everyone has to breathe the same air. So it affects everyone, and so we wanted to make people aware of that. We added a small tool, which is from facial scanning. You can get a blood pressure and heart rate. Hypertension is a huge problem globally. If we can diagnose a high blood pressure in the right manner and a timely manner, even if we can provide a remote care to the patients, we can make them live longer by 5 to 7 years. It's a proven data. So making available through an AI of facial scanning and give a blood pressure and heart rate and more data sets in the future, including depression, into happiness, into stress levels, so many different things we can guide them using facial scanning. So all of those tools can provide not only an education for themselves to see it's not going to cost me much money. There's an AI technology tools with the variables or the things I have at home. They
Yeah.
are interconnected with that. Now I can learn from it and help perhaps self-improve myself and move more towards healthier living.
So that's obviously self-management, which of course is a real fundamental to everything, right? So, but of course there are concerns that we all have. We all need medical professionals to be able to help us interpret more complex data. So, how do you see this transition between a wearable, maybe using your app and your data? How does that transition into the clinic?
Well, as simple as how we use a blood pressure tool. So people, if they're having a high blood pressure, they've been checking it regularly, and it's their home, in their environment, and they may be stressed out, maybe they're happy at that time. So if the trend is indicating the numbers are on the higher side, so now AI can nudge them. They can tell them, look, I'm understanding, and all your blood pressure is running a little bit on the higher side. Do you want to talk to a doctor? So that's where doctor can come in play.
Hmm.
So in the meantime, AI can guide them, okay, the strategies, exercising, losing weight, reducing salt intake, those are free. And those services can be provided by AI because we only have a limited resource for the doctors there
Yeah.
or globally. So this is how I see technology coming in play. As simple tool as flagging the problem and predicting potential worsening condition from a cardiology or stroke perspective. And if you can connect to the doctor in real time after getting the permission, I think that's the best innovation we can, or the service we can provide at a mass level.
Yeah, yeah. So of course, you're very focused as a clinical professional through your career, as obviously running a clinic as well, on the interventions that are available to us today. Um, there's a lot coming down the line in relation to advancements in biotech that are kind of reshaping the way that healthcare is being delivered. You've obviously mentioned AI, which is supporting clinicians as well. What are the areas that you see are shaping the way that longevity is going to form as an industry over the coming years?
I do believe, I think we will be moving away from a regular health record system based clinics or health organizations. I think it will be more data focused, longitudinal record focused. This
Hmm.
is why I see a big growth is going to happen. All these variables, it's just a start. Just imagine the smart mirrors and the weighing machines, the water we are using, the type of food we're eating. There's so many different insights now we can get from epigenetic perspective that in fact impacts our aging, the telomeres and methylation. So if we can understand all these data sets where the patient is living in a longitudinal manner, usually what happens in healthcare is we only get a data when the patient comes to see me as a doctor, and then I get a history and see whatever is missing. Then I try to make my conclusion and try to make a plan based on that. But the new technologies, like ELR-based technologies, so they provide us now longitudinal capabilities. Doctors will have a large amount of data sets. They will understand much more about the behavior of the patient, using AI tools that is going to help us improve and provide better care to them and help them live longer. I think that'll be the huge impact I'm expecting. It's the
Yeah.
lowest hanging fruit, and it's going to change how we practice medicine globally.
Yeah. So let me ask you a question, Amal, which is one that's really coming out of the data that we have. We've just done a longevity clinic survey. There's an ambition to share data. There's an ambition to use wearables. There's an ambition to use AI support tools for both nudging clients and patients, but also assisting the clinical care team to help identify issues down the line. Do you see that really the infrastructure that we have, when you've got obviously data protection, you've got EMR and EHR systems that are very rigorous and obviously rightly so because they're backing into large healthcare systems and large data systems. Do you see the future when, Dubai is a very interesting place, lots of transient people, they're coming in, they spend 3 months in Dubai, they then go home for 3 months, they go maybe to the Far East for 3 months. How do you see the way that the regulatory aspect of having this data and having the data accessible by the individual themselves, but then in sharing that data with different care teams, is that something where we see blockchain and the way that data is going to be really available internationally, and digital autonomy. So you as an individual own the data rather than it being apportioned out to different clinical practices. Do you see this as something that's going to change?
Definitely. Thank you so much for mentioning. What in fact we have done is through a blockchain company, Handwritten, we deployed a layer one blockchain network of our own, and we built a DNA-based NFT platform where you'll be able to identify yourself, and this is my NFT based on my DNA or whichever the ID we can identify
Mm-hmm.
internationally.
Yeah.
And an NFT defines the ownership. I'm the owner of that NFT, and then what we have done, we link their digital file under that digital wallet. So now your DNA file, your health record file can go inside, and you are the owner of that file. Because from a Canadian perspective, for example, in Canada, patients are, or the citizens are the owner of the data. We as the doctors are custodians of the data. But usually the patients never have an access. They have to pay sometimes to get an access to their own healthcare data. So by defining an NFT as them as the ownership, and now all these ELR systems, the health record systems, now they have to feed data into these digital wallets. So then if I'm traveling to Dubai, to UK, to USA, so all this data doesn't matter where I'm going, and this interoperability of data without competing with them, because the biggest issue becomes various EMR companies, EHR companies, they have their personal interest. They don't want to talk to each other. So the government pushed on HL7 connectivity, FHIR connectivity. They're still struggling to get people talk to each other because they always bring this privacy issue around it. But by law, patients are the owners. So to bypass that, make an NFT, make a national identification card, and under that is a digital wallet. Now mandate that doesn't matter which ER company, EMR company you go to or interact with it as a patient. So they have to feed the data or all the records into that system. So it becomes organized, under your control. Now, you as a patient can decide you want to donate to the people, you want to sell this data to a pharma company. You can track all these longitudinal files in one place. Since you are the owner, you can rent it out, you can give them for research purposes. I do believe blockchain is going to unlock the huge potential, give ownership back in the people's hand. Otherwise, the governments like to have more regulations. The blockchain opens up the opportunity for us to personalize care to be delivered, control back in the patient's hand.
Yeah.
I'm very positive about that.
So where are you on that, Anmol? Have you got an alpha or a beta running on this? Is it live, or is this something that's going to be a journey that you started? That obviously backing into these big systems is going to be complex and regulated, so it's going to take time. But where are you with it at the moment?
Well, right now we have deployed the NFT. We have made a digital wallet. We are launching a mobile application end of January. There you'll be able to update and back up your data through blockchain encryption. So you can choose not a traditional cloud. You can go through blockchain cloud. So that is upcoming change. That will open up an era of this independence of the data migration and data control. People will be able to make their own NFT. Will be able to link the digital wallets into that, and many more things coming along the way. So we have also, in fact, running experiments right now with our own ELR technology. We have built a longitudinal record health system. So essentially, this digital wallet will connect with the ELR system or EHR system or the EMR systems. And we, in fact, we are showing this project to one government agency. I can't name them. So there's a challenge happening internally where they want to see interoperable data moving from state to state, the province to province, so cities to cities. And the idea is there's a national identification number of every person living in this country, and having this NFT identified and links with that. And now data from various EMRs, EHRs, ELRs can go inside. So we are
Mm.
showcasing them how we are moving the data inside early next year. And if that project succeeds, we believe positively that they'll be interested to deploy at the national level.
Yeah, fascinating. I mean, obviously, heavy lifting, and more, right? It's going to take time to do all of that. But I guess if we can get that autonomy, that would be a wonderful thing for the growth of this sector, and obviously the individual autonomy that we need when we're kind of jumping between different clinical groups or different advisors because we're not getting the results that we want. So before we wrap up, Anmol, so let's talk a little bit about Dubai and what you're doing there clinically.
Well, in Dubai, we open up a clinic. It's a multi-modality, multi-specialty clinic with cardiology, internal medicine, family medicine, dental, derma, psychology, nutrition, kinesiology, chiropractor, you name it, including home care. Everything has been approved by Dubai Health Authority, this clinic. And we just deployed a mobile application. We're running a longevity fitness challenge. We have thousands of people participating in this challenge these days. And then by the end of this month, we are going to pick the top 25 people who would have run the maximum steps in a month, and we are going to nominate them as the UAE's top 25 longevity champions. And we'll provide them free of cost epigenetics, transcriptomics, microbiomics, genomics, other physical and radiological assessments for free. This way, they could be an average person on the street, could be the richest person going to win the challenge. We don't know, but they will get that testing for free. Afterwards, we're going to announce our subscription model for the longevity programs we want to participate. There'll be various levels of that, from affordable to the more expensive levels, depending on how much data they want to analyze and help from our team. And we're looking to launch the services in the UAE, and from there, looking to grow globally. So we are very excited about that, and looking forward to start this journey where I always been passionate about making people live longer, and now I truly can do it. So I'm
Yeah.
very, very positive about that.
Great. Well, it sounds wonderful, Anmol, and I'll be in Dubai in April and March. So looking forward to seeing you when I come out there. Thanks for joining us today.
Thank you so much.